Question number 1. Which of the following is true about Poland syndrome? There can be absence of deltoid, absence of teres major, radial bone abnormality, webbed fingers, hypoplastic nipples. So when you look at the Poland syndrome, you can have the radial bone abnormalities, you can have the webbed fingers, or you can have the hypoplastic nipples. Evaluate the following statement with respect to CTV. 50% cases are in males and bilateral. Forefoot is adducted and supinated. With Ponseti technique, correction up to 90%. Equinus should be corrected first. So D is not correct. So the answer is A, B and C are correct. Match the following. Osteogenesis imperfecta. Multiple fractures will be there. Neurofibromatosis. Coffee color spot will be there. Marfan syndrome. Hyperlaxity will be there. Littlefield syndrome. Short wave neck will be there. Management of DDS. Sequence of the surgery. Capsulotomy. Femoral osteotomy. Acetabular identification. Place the head in acetabulum. So first open the joint. So the first step will be A. The two answers can be correct. Second, identify the acetabulum. So in both, the second point is same. Third, femoral osteotomy. So B. And last is the head in acetabulum, because once you cut the osteotomy femur, then only you can put it right. So the answer here is capsulotomy, identify the acetabulum, cut the femur, get the head inside. Match the following. Maid lung deformity, volar translation of the wrist, Haglund deformity, bony prominence of the calcaneum, buttonhole deformity, seen in rheumatoid arthritis, gunstock deformity, cubitus varus. The following muscles cause inversion of foot except peroneus are reverters, they won't cause inversion. Polio hand knee gait is due to paralysis of quadriceps. A neonate was brought to the hospital. Which deformity should be corrected first? Cavus, mnemonic is cave. Choose the correct statement regarding Perthes. It may be asymptomatic is true. Plain X-ray findings can be missed in early stage, true. Avascular of femoral head, true. Weight bearing is indicated of exercise, no. Conservative management steroids, no. In a case of child abuse, following are the X-ray finding except subepiphyseal microfractures are MRI finding, so they can't be seen on X-rays. The following pelvic X-ray was seen in a patient. All the following signs will be present except Ganslin is for sacroiliitis will not be seen. Pirani score includes all except. So which of the following is not a part of Pirani? So medial crease. So you do have a medial crease. Protrusion of a cuboid bone is not a part. Lateral crease is not there. You have a posterior crease. Curvature of bottom is there. Concavity of sole is not there. So answer is B, C and E. The following is seen in congenital pseudoarthrosis of tibia. Which among the following are true about Perthes? Self-limiting, bilateral in 20%, femoral head displays anterior. It's lateral. It's a painless condition, more common in males. So A, B, D. True about CTVR. Foot is flexed downward, true. Sole crease is there. Difficult to treat, true. May occur due to neurological disorder, mesothelial meningocele. So A, C, D, E is the answer. SCFE slips in which direction? No slip. Question number 17. 11-year-old 70 kg child, overweight. Limitation of abduction, rotation of the limb. Affected hip joint. Tenderness in the Scarpa's triangle, painful condition. Answer is slipped capital femoral epiphysis. The ideal treatment of bilateral idiopathic CTV in a newborn is manipulation and cast. Spot diagnosis for this foot deformity. Very, very important question. Rocker bottom foot. Ponseti technique failure in children should be managed with. If it doesn't work, do a post-medial soft tissue release. Common fractures in childhood are all except forearm fractures, one of the commonest. Elbow injuries, very common. Hand injuries, very common. Spiral fractures are common but rarest out of the four. The following brace is used for which condition? You're trying to place the thigh in the direction of the hip in the direction of acetabulum. So this is important for developmental dysplasia of hip. So this is about pediatric orthopedics. Thank you very much.